Hello, everyone. This is Francine Crawford, and welcome to my show, Autumn is Here. Today, we are blessed with another interview with Dr. Osei-Tutu, and he's here to tell us about a disease that we don't talk about too much, and he's going to give us some information and some insight on that. So let's welcome him to our show. Welcome, Doctor.
Thank you, Francine. By the grace of God, I'm well.
Good. So for people who may not have met you before, tell us a little bit about yourself and your profession.
Okay, so I'm an internist, an internal medicine doctor.
Okay.
An internal medicine doctor is an adult doctor. We can treat everything from head to toe. Mm-hmm. We treat both males and females. Usually anybody over the age of, I'll say, 18 and up. Okay. All the way to probably, 70, 75, 80. Okay. And I've been an internist. I finished my training in 1987. So I've been in practice since 1987, and I'm board certified in medicine 3 times.
Okay. Awesome. Well, we're glad to have you here. Today we're going to talk about multiple myeloma.
Correct.
And I want to know, things this is something that I've heard about. I've been affected by it because my father died of it. But I'm not so sure that everyone knows about this. And it's something that people should know about. So can you kind of explain what it is exactly?
Okay, so multiple myeloma is, one of the cancers of the bone marrow. Okay. So look at it this way. The bone marrow has 3 main cell lines, 3 main things that the bone marrow makes. Mm-hmm. They make red blood cells, white blood cells, and something that most people have not heard of is called platelets, P-L-A-T-E-L-E-T. So if your doctor asks for a complete blood count, what they are, essentially looking at is your white blood cell count, red blood cell count, and platelet count. Now, each of these entities play a crucial role in terms of our ability to exist as human beings. Very, very, very important. So I'll go through each of the lineage. Your red blood cells essentially carry oxygen to your body. Nothing in the body can survive without oxygen. Right. You need oxygen. Right. So that's the function of the red blood cells. I'm not going to dissect it. There's something called hemoglobin, which is part of it, but I'm going to just neglect that for now. Yeah. Your white blood cells, of which there are about 5 different subsets, helps you fight off infection. Viral, bacterial, fungal. Before even the doctor gives you the antibiotic, your white blood cells is already on the ball, using your immune system to defend you against this invading fungus or bacteria or TB or whatever. Right. The antibiotic then goes to augment the function of the white blood cells. They work in tandem. One without the other, the outcome is probably not going to be good. You need both. But usually the white blood cells will start, fighting off the infection. And then while that is going on, the doctor then prescribes you the proper antibiotic, and in tandem, be able to, rescue you from whatever infection, was trying to do you in. Mm-hmm. The platelet, the function of the platelet is to prevent you from, bleeding spontaneously. Any cancer that affects the bone marrow, these are the normal population of the bone marrow. If you have a cancer, any type of cancer that affects the bone marrow, these cancers have a tendency to outgrow these normal cells and choke them out.
Okay.
So, because when that happens, then you're going to suffer the consequences of whatever the red blood cell is supposed to do, and now it's not able to do because it's overwhelmed by the cancer and likewise the white cells, and likewise, the platelets.
So that in multiple myeloma, that's what happened?
Okay, so multiple myeloma is very interesting. That's what happens. It's a very rare disease, more common in Black people than other ethnic groups. And in multiple myeloma, the problem resides in a subset of the white blood cells called the B lymphocytes, right? The white blood cells has T lymphocytes, B lymphocytes, and I'm not going to go any further. So the B lymphocytes make antibodies, and these antibodies, their primary role is to help you fight off bacterial infection. The B lymphocytes make the antibodies, and then the antibodies, the primary function of the antibodies is to help you fight off bacterial infection. In multiple myeloma, the B lymphocytes make these cells called plasma cells. Actually, the antibodies are made by the plasma cells. So the B lymphocytes make the plasma cells, and then the plasma cells make the antibodies. But in multiple myeloma, the plasma cells that the B lymphocytes make are deranged, are abnormal. So because the plasma cells are abnormal, the antibodies that they make are abnormal. Even though they make a lot of it, it's abnormal antibodies, so they are defective. So they don't function like regular, normal antibodies. And because of that, you become susceptible to infection. So a lot of these people will die of overwhelming infections.
Oh, okay. So the symptoms of multiple myeloma, what does it do to the body?
Okay, so the symptoms are this. In a normal cell, when the cell multiplies up to a certain point, then there are cues that the body will send to the cell to say, hey, we have enough of you. Stop. Don't do any more. Okay? Until that level falls, and then the cue will kick in again, and then the body will make whatever it's making. In cancer cell situation, the cells keep producing. The things that they are producing are abnormal. So because they are producing all these things too much, they take over the bone marrow. So the area that makes the red blood cells, it's not going to make it because they are overwhelmed by the cancer cells.
Right.
The area that makes the normal white blood cells is not going to make it because the multiple myeloma cells have taken over. And then the platelet, the same thing. So because of that, people wind up with anemia or low red blood cell count, right? Because the multiple myeloma cells have encroached on the cells that produce red blood cells and have taken over, so they cannot make the red blood cells. So the red blood cell level falls, so they become anemic. The white blood cells go down for the same reason, and the platelet counts go down for the same reasons. So if your red blood cells is what carries oxygen around, and all of a sudden you are anemic, you cannot carry enough oxygen, so you get tired, right? You get tired, you get weak. You may get short of breath because you cannot carry enough oxygen to your lungs.
Right.
And in people who have coronary artery disease, for instance, they can even have a heart attack because there's not enough oxygen going to the heart because of the profound anemia. And one of the symptoms of profound anemia also is headache. So you can have headache. In severe cases, when you are very anemic, the heart has to work extra hard. You can even go into heart failure.
Okay.
And you can also, in bad cases, you may have difficulty even mentating right. You cannot think, you can become disoriented. No. And that's all from the anemia.
Oh.
All right?
So it's like
now,
it's like foggy.
Yeah. And then because the white blood cells, is also depleted because of this, the plasma cells, abnormal plasma cells taking over the bone marrow. you become susceptible to infections because you don't have the white blood cells to help you fight off infections.
Right.
So these patients may present with urinary tract infection, pneumonia, abscesses, sinus infection, meningitis, whatever. So then that's what they may present to you with. And then when you do the blood test, so the pneumonia is what is coming to you, but beneath it
is this
multiple myeloma that is overwhelming the white blood cells, and therefore the person is developing infection.
Okay. So it can look like something else.
It can. So it can present as anemia, profound anemia with anemia symptoms.
Right.
It can present with low white blood cell count with infection symptoms.
Mm-hmm.
It can present with bleeding because the platelet count is very low, right? Mm-hmm. Bleeding or bruises. If your platelet count is low, you can bruise, you can bleed.
Mm-hmm.
So when you this must have been going on for a while. Right. So when you show up, the person is having fevers at home, shaking chills, and you prod them to go to the emergency room, and they go to the emergency room. Doctor listens to them and says, "Oh, you have pneumonia." They do the chest X-ray. There's pneumonia, and usually they will do the blood count and whatever chemistry, and then this is what is going on. But usually it's not. They'll call the internist, and then you put everything together. It's like being a detective.
Right. Are there any causes? Do they know like what causes this, or are there any causes?
Causes. A lot of cancers are genetics.
Okay.
We believe that also environmental exposure, same things, but there's no clear cut.
Okay.
Clear cut, ideology, is just there. And then, that's it.
So how do they, so since there is no clear cut cause for multiple myeloma, how do they test for it? Like what would make a doctor test for it?
Okay. So that's where the good clinician comes in.
Okay.
That's where the good doctor comes in.
Okay.
Because what is fascinating about internal medicine is it's like being a detective, because it's like being a detective. Nobody is going to show up on your doorstep and tell you that they have multiple myeloma.
Right.
You have to get a good history, do a good exam, and then based on usually with a good history and a good exam, a lot of times you probably 90% you may have a clue as to what is going on. And probably the 10% of it is the lab to confirm what you already suspect. But usually what would happen is this. The person may show up with fever and they feel very bad. I'll use a female patient. Fever, they feel very bad. They come to the emergency room. You do urine test, and the urine test looks like they may have urinary tract infection. And you tap on the flank. The flank is where the kidney is. So if the infection has gone to the kidney, they're very tender. They cannot even do that. They jump. And then you look at, so they have infection. And urinary tract infection is very common, especially in women. If it's a young woman, you may not look any further. Just give them the antibiotic and they go. But if it's usually an elderly person or something like that, a lot of times the blood test that you do, the chemistries and the blood count is really going to help you because what they are presenting with is the bone marrow, the problem in the bone marrow that has been caused by the multiple myeloma because it has wiped out the white blood cell count. So as a result of that, these patients have become susceptible to infection, and it can be any infection. So you look at the CBC, the complete blood count.
Mm-hmm.
And you notice that the white blood cell count is very low. And they are also anemic. Right? The red blood cell count is low, the platelet count is low, and you look at the patient and they have bruises. So that helps you to know that there's something going on in the bone marrow, because the bone marrow, all the things that the bone marrow makes is down. Mm-hmm. So it must be something infiltrating the bone marrow that is causing that. So that's your first clue.
Okay.
And then when you look on the sometimes if you are lucky, when they do the CBC, right, sometimes they'll look at it on the microscope. They'll stand it and look at it on the microscope. If you are fortunate, they may see something called rouleau, Rouleau, rouleau formation, which is the red blood cells stacking together like coins. When you see that, that's one of the tip-off for multiple myeloma.
Oh, okay.
Okay, so if they did that, sometimes they may see that you're stacking together of the red blood cells. Wow. So that may help you. And then the other thing that may help you, the chemistries. Look at the chemistries. Mm-hmm. And then you see, the person has, in addition to the anemia, their kidney is functioning right. Their calcium level is high. Uh-huh. Their globulin level is high. When you see that, it's like, it's like
a puzzle. You put it all together.
Yeah, it's like, oh my goodness. Yeah. Any astute doctor who knows what they are doing, mm-hmm. It will click.
It will click.
That, it looks like we are dealing with multiple myeloma. They usually have one spike.
Okay.
And then when you see that, it's looking more like multiple myeloma, and then you are going to do bone marrow biopsy. Mm-hmm. Bone marrow biopsy, where they go to your back and they put a needle, they numb the area, put a needle, get a sample of the bone marrow, give it to the pathologist to look at it.
Who's at risk with this? Because it's interesting, because I heard that it was older people. You see, yes. older people.
Yes.
Black people. So who's actually at risk that should pay attention to this?
The thing is, luckily, it's a rare condition. It's not common. Okay. It's not common. At risk, there's no such any particular person being at risk. It's more common in Black people. Mm-hmm. More often than not, it's rare to detect. There are certain types of leukemia where regular blood count can pick it up. Mm-hmm. Usually people with multiple myeloma, it's very rare to pick up somebody with multiple myeloma who does not have symptoms. Usually they'll come in because they are symptomatic. They have something going on. Right. And when you do the blood test, then it reveals the abnormality and all that.
But older people are susceptible to this?
Your case, usually your case in people like 60 and up.
60 and up.
60 and up.
Okay.
60 and up. It's rare. It's not common.
It's not common.
Mm-hmm. Okay. It's not common.
Okay. So the treatments for this, is the treatment like a pill, or is it chemo, or is it
okay, so when the abnormal plasma cells overwhelm the bone marrow, the patient will become anemic, meaning low red blood count, with mm-hmm. fatigue, maybe chest pain, symptoms of that. They may also have low white blood cell counts, which makes them more susceptible to infection. They may count, which makes them more susceptible to spontaneous bleeding. Okay. Now, initially, there's a pill that you can take, but initially these patients usually may require, transfusion support, right? They may need blood transfusion. The white blood cell count usually, the problem is with the antibodies, because the antibodies that are produced by the white blood cell counts are abnormal.
Okay.
So that's why they get infection. So they may need periodic antibody or what we call gamma globulin infusion to bolster the immune system. And when the platelet count is low, they may need platelet transfusion. Now, in terms of treatment, there's a pill that, there's a medication that is called thalidomide. But it's one of the treatments for multiple myeloma, so we use it. But there are more newer medications that we also use, for multiple myeloma.
Okay.
Usually, one of the things that you can use is what is called stem cell transplantation in the proper candidate. You use chemo to try to destroy all the cancer cells. But when you do that, invariably you also destroy the bone marrow cells.
Okay.
So then you do the stem cells transplantation. You can get it from the same patient, which will be what we call allogenic if it's coming from the same patient, or you can get it from somebody else.
Okay.
The stem cell, and you infuse it. And so when you infuse it, then the stem cells will will repopulate the bone marrow and make white blood cells, red blood cells, and platelets. But usually, it may buy them some time. But the disease is treatable, but it's not curable.
It's not curable.
No.
Okay.
No.
Yeah. Well, like I said, my father died from multiple myeloma.
Yeah.
And I never heard of it before.
Right.
So, and when I was talking about like risk factors, just like when if you're, you have certain cancers in your family or whatever, you get tested. Is that something that because he died from it that they should report me?
No, it doesn't. No, multiple myeloma is one of these. There's some gene mutations that may cause it, but no, it's not something that we screen for.
You don't screen. Oh, okay.
That.
Okay. So
go ahead.
Do you know that if it's increasing in the month of people having it, or it's just something that's rare?
If it's increasing, it will mean that we have better ways of detecting it now than we used to.
That makes sense.
But probably the same, but way back we didn't have the good, diagnostic techniques.
Well, this is interesting because it's bringing me somewhere else other than multiple myeloma. It sounds like what would you suggest? Like as you're aging, what you're talking about is like the doctor has to really probe into these things. They have to do these tests. They have to, if you're older and you have the same doctor and you kind of get used to that. And I think they get used to you. So is it that if you stay with your same doctor, do you think that's better because they know your history, like you were saying, your chemistry workout? Or when you get older, you have more things that are wrong with you or may be wrong with you possible. Is it better to, kind of see other doctors or specialists?
No, not necessarily. Not necessarily. What I always tell people is this. You need a good internist, period.
Period.
You need a good internist. An internist who is a cut above the rest. An internist is like the conductor of an orchestra.
Okay.
If you want to play symphony or whatever, you need a good conductor.
Okay.
Otherwise, you're going to have a cacophony. You understand? So the internist, if they know what you're doing, the internist may be able to do things up to a point, but they know where to send you once they get to a point that is beyond their expertise or training. Okay. But if you do not have that, then you're going to have problems because, they may be seeing something that is really bad. Like, you get, say, CBC from the lab, There's rulo.
Mm-hmm.
How many people know what the significance of a rulo?
Right.
The person may read, rulo,
right.
and to pass.
And they don't
you
know.
Understand what you are looking at it? You have non-iron gap acidosis. Your calcium is high. Your globulin is high. There's problem with kidney function. You are anemic, and it will not even register. A good iron will that right away. Okay. So that's very, very important. Now, this is what I'll leave you. And I want you to be listen to this very, very carefully, okay? If a female in their menstruating years comes with anemia, a lot of times, especially the teenagers and young adults, their diet is not the best. Right. They come in with anemia and it looks like iron deficiency. I'm not going to look any further unless there are other things that makes me worried that the anemia may belie something seriously going on. But most of the time, anemia is very common in women of childbearing age. They menstruate every month. Every time you menstruate, you lose blood. You don't eat enough stuff to replenish the iron. And then with pregnancies, you lose iron to the baby. So, iron deficiency anemia is very common in women of childbearing age. However, if you see anybody who is postmenopausal and no longer menstruating and they have anemia, don't dismiss it or start treating them with, unless it's clear-cut like a young female patient. Anemia is a tip-off of a lot of bad things. If you see anemia, even a little dip in the blood count in somebody who is no longer menstruating, postmenopausal, look further. Don't start giving them iron or look further, because there are a myriad of reasons why somebody may have anemia. Not every anemia is due to deficiency. There are so many reasons. Okay. Right. But anemia is a tip-off of a lot of things. It's the first, one of the manifestations of cancer. One of the manifestations, a plethora of medical conditions. So anemia is a serious business. If you see anemia in any woman who is postmenopausal, no longer menstruating, or in a man, you have to look further. Okay. They may have polyp in the stomach, they may have colon cancer, they may have ovarian cancer, almost any cancer.
Wow.
Okay, so anemia is not something that you should really ignore.
Right, yeah.
It never be treated. Okay, so if I can impart you with one message, that's it. Anemia is serious stuff.
And speak up if you have anemia or whatever, and you're after menopause and things like that. Speak up if your doctor doesn't order certain tests or look into it any further.
If they are going to give you an iron, run and find another doctor.
Find another doctor.
Yeah. That's it. Run.
Okay. Well, thank you. Is there anything else you would like to say?
So that's one of the bone marrow cancers, and then there's like leukemia, the leukemia cancers and other stuff. But so that's it. Now, at our next talk, you come up with any topic, and I'll be happy to talk to you about it. If you want to stay with cancer for now, until we exhaust it, we can talk about breast, colon, lung, liver, the leukemias, and then we can work our way down. We talk about anything, head to toe.
Okay. Well, thank you. I appreciate that. So many people they don't know because people don't talk, like they don't drill their doctors.
Right.
You accept what they say, you trust that they're educated, they're giving you good information, and you go home and that's it. So it's good to have more information so and you can ask questions and you can, just check yourself. You got to be an advocate for yourself also.
Yeah, absolutely. Yeah. The doctor is not God.
Right.
Okay. Doctor is not God.
Right.
We have some knowledge, but we don't know everything.
Right.
All right. So if there's something you as a patient you don't understand, and the doctor is not able to explain it to you well, you can always get a second, third, fourth opinion. All right. And keep asking questions. Right. Okay. And remember, anemia is not to be trivialized because almost any cancer that you can think of, I can think of maybe 2 cancers where that does not come with anemia. Almost every cancer will come up with anemia. If somebody is bleeding internally, they have anemia. If somebody has kidney disease, even heart failure, you can get anemia of chronic disease. So anemia is serious stuff. Yeah.
Yeah, I didn't know that. And
oh yeah,
you're right. People just say, "Oh, I'm anemic," and it's no big deal. You take iron and that's it.
A lot of good medications. One of them is called borzitemib.
Okay.
Borzitemib. And it's very, very similar to thalidomide. Because thalidomide used to have a lot of bad side effects, they tweaked it a little bit, and there's a medication called bortezomib that is used now.
Okay.
You can buy yourself time. So, quickly, how do people with multiple myeloma die? I want to talk about that quickly, and then So, because their immune system is not functioning right, because they don't make the right antibody, a lot of times they will die from overwhelming infection. Okay, either that or kidney failure, because one of the things that comes with multiple myeloma is kidney. Your kidney, it destroys your kidney.
Right.
And then, so overwhelming infection, kidney failure, and if your platelet count is very low, right, you can bleed. And if you bleed into the brain, and it's a massive bleed, that's it. You are not coming back. So one of those things. But it's usually, bone marrow failure, infection, overwhelming infection, or kidney, bleed.
Wow. Okay. Well, thank you very much. I appreciate you coming back and give us information. Important information, and I really appreciate that. So thank you for all your information, and hopefully, we can help somebody. Okay?
Yes. Yeah, it's a lot to digest.
I know. Thank you again.
My pleasure.